Oh yeah, I'll get it all out. All right, you guys. As you know, I'm Sabrina Rodriguez, also known as Sweet Pea. I am preparing myself for my very first fight, my debut, as you guys may call it. And my friend Derek here offered to go ahead and help me regain some of my muscle usage properly, because you guys know, being in the sport, we get injured, we get overly exerted, and he is bringing me back to life. Now, Derek, can you explain to me a little bit what you worked on for me?
All right, so I am a neuromuscular massage therapist, certified. So what we did was a deep tissue massage, but I was really focusing on her muscle usage, making sure she had full range of motion, especially since she had ankle surgery. So we did a lot of reflexology today on her feet, PNF stretches to help her get a little more flexibility in her feet. Also, too, we did stretching on her lower back, QL, glutes, and a lot of work on her quads to get those muscles flexible enough to where she can move the way she needs to in the ring.
Nice. So what part of my body do you think, outside of my leg, did you find most tension?
It was gonna be in your glutes and your neck.
In my neck?
Yeah. Well, the glutes are usually because we're always sitting down, driving, commuting, and the neck is shoulder area because a lot of people will put stress on their shoulders.
Okay.
Depends on if they're doing secretary work. I know you work in real estate, so a lot of paper not getting hunched over. So that is the two areas, just from sitting down and here. And then when you add training in part of it, now you're actually having to use those muscles to maneuver. And so yeah, it was a lot of get in there and make sure everything was right along the, especially along the piriformis muscle and along the sciatic nerve to make sure nothing got pinched up and you get injured in your match.
Talking about the sciatic nerve, you guys. Now, when I told him that I had an injury, you guys, if you've been following me for a while, those who know me from the fight life industry and see me out at shows and stuff, you guys see me on crutches, you guys see me on my scooter, all this stuff, and not just crippled but pregnant. Now, you guys already know pregnancy is this whole thing in its own, and I had a lot of sciatic nerve injury, and I felt it when you were going into that muscle in my glute, from my glute, correct?
Yeah.
Dude, it felt, when I say it hurt so good, it hurt so good, you guys. I was like, I even had like a little chuckle. He's like, are you okay? I'm like, yes. But talk to me about that part of the muscle, because I don't think a lot of people know how the glute aligns with that sciatic.
Yeah, because it starts from your lower back. That's where the nerves endings go, and it goes down. But it goes right, main side part of it goes right underneath your piriformis muscle. And if that muscle is tight and gets irritated, it'll inflame and get a little bigger, but tight. And a lot of times it'll push down on the nerve.
Okay.
And then it just shoots off signals wherever. So you could have it there, and I could hit your calf, your hamstring, and you'd be like, and you'll feel a jolt from there all the way up. So it's most of the time it is that. A lot of times most of the time it is that.
Okay.
Sometimes it's not, but a lot of times they're saying, and then we ask, do you play a sport? Do you power lift? As soon as they say we play a sport, I power lift, I do that, like we go right to it, and that's usually the first thing we go to, just so we can rule it out. But a lot of times once we go right in there and we start stretching and doing a MFT stretch along with doing a deep tissue there, and you'll feel as you did, you're like, what the hell? And you'll tighten up and go there, and then I'll start moving up towards the piriformis, glute medius, glute minus, and then it's like, it's a deep pressure, and you feel it, and you're like, then once I let go, you're like, oh, it's gone. And so that's a lot of times what neuromuscular therapists try to do is not so much make you feel better, but to get you better to where you can move, where you're not in pain anymore.
So that's something that you did say. He asked me, when was the last time you had a massage? And myself, personally, I like to say I do a lot of self-care, you guys. I like to think I do. And I don't think we're doing it properly. So when he asked me, I was like, I went and got a massage here. And he was like, you got a fluff massage. And like he said, sometimes that pressure that you have to apply to get the proper usage out of your body is so vital, right?
Yes.
And that's pretty much what he did, because I was like, it wasn't something that was completely enjoyable, but when that release was there, I was like, oh my God, I can move. Like my neck, like you were saying, my neck was so tight, and from the sports that I do and my jobs and all that, bartending, being at a computer at my desk, working, yeah, I do get very, very tight. And I want to say too, when my coach cracks me here and there every so often, I'm like, oh shit, you know, and that tension was there, and a lot of the muscles were released, and I feel great, you know. Okay. So when you do get your clients, how do you approach them? Do you ask them based off what it is that they're looking for their therapy?
Yes. So I work at Valley Chiropractic in Manteca.
Okay.
They're most of the time with a Dr. Atwall and Dr. Durant. Those excellent chiropractors. I love working with them. And so a lot of times, them is mostly case injuries, patients with a hurt, sometimes job injuries, stuff like that. But a lot of time is just people just coming in for they need to get their realignments there. Okay. So sometimes their muscles are really tight too, and they're like, hey, we got a massage therapist, come meet him, and I'll come in, do a little palpation, and say, this is what I recommend, and this is what we can work on. Okay. And so we work with everyone, but everyone's different. It's not always the same thing. Everyone's different. Sometimes it's their shoulder, and there's like, oh man, my shoulder. And it's like, hey, what do you do? Oh, I got a baby. I'm like, oh, I got a new baby. Okay. So I go to their shoulder, and we work on that, and then I'll go right to so it's their right shoulder, but I'll go for their left hip. All of a sudden, now it's like, how did you know? It's like, well, you're holding the baby like this. Because you're lifting up the baby, but then you're shifting to your left side. Now you're putting all your weight on your left hip because you're holding your baby in your right arm. Okay. So you're trying to take the pressure off your left leg, and now you're putting it on your left.
And that was something we were talking about when I was like, dude, this side, my good side, my strong side is what's always, I feel like, it's hurting, you know? And then it's because it's taking most of the pressure from where I had my injured at, which all makes sense now.
Yeah, so the body's connected, and the body will always, my theory is bodies will always compensate to relieve itself from pain. So if it's hurting somewhere, it'll do something to get you out of that pain, but it'll put pressure on somewhere else. So if you're having lower back issues, a lot of times you'll lower your stealth to leave the pressure, but now you're putting pressure on your lower abs. So when I got you, when I got your abs on your left side, and you're like, oh, I'm like, because you're compensating.
I will tell you guys, I've never had an ab massage. She's like, hey, this is going to be weird. I was like, you know, Derek, I've known you for a few years. I was like, I trust you. And he got my abs. I was like, holy shit, you guys. Like I said, these are things that I never thought of. Yeah. You know, and I guess when we have an expertise like yourself, you know, we're here to help out. Can you let them know your handle so where they can find you at?
I got a bunch. I should narrow it down to less. So my main handle is AlphaWolf209MMA. Both on Instagram and YouTube. And there I have my main fight videos where I teach martial arts here at my gym here in Turlock, California at Williams Martial Arts and Fitness. I've been doing this a little over 30 years now. I've been a massage therapist now for about a little over a year, just getting my handling, but just my training in the martial arts and then going to massage, it made a transition so much easier. But no, the teacher's there. She was wonderful, Christine. She's like, Derek, we're not here to hurt the body. We're here to heal the body. And I'm all like, got it. But a lot of the stretching we did and like a lot of stuff we do in martial arts, like with jiu-jitsu and stuff, do turn over to when I was doing massaging for stretching. So instead of going all the way, I go a certain way. Now I can actually get a good stretch out of the person. Same thing with doing key lock. From here, I can stretch the bicep and all the way from the bicep to the pec minor to the pec major.
As you're doing jiu-jitsu?
As I'm just doing jiu-jitsu, just learn those different things. I'm like, just slow it down and angle like there's a stretch.
Oh, wow.
Versus if I change another angle, rip.
Rip? A stretch to rip.
Yeah, so there's a difference between. So now it's like, okay, I can heal you or hurt you. You know, how you coming at me?
The hurt and healing man. There we go. Thank you so much, Derek, and thank you for helping me with my hurt.
Oh, no problem. I can't wait to see you fight, and you know, always see her cheering at my guys on at 209 Beatdown and other events she goes to. So I'm glad I can help, and she trained with my old Vanguard Team Voodoo. So I'm like,
yes.
Yeah.
Like I said, fighters stick together.
Yeah.